As people cross the threshold of 60, many begin to notice subtle yet unsettling changes in their ability to perform everyday tasks. Standing up from a low chair suddenly feels like lifting weights. Climbing stairs demands surprising effort. And sometimes just walking across a room becomes a cautious, calculated act due to occasional loss of balance or leg shakiness. These seemingly minor challenges are often overlooked or attributed to just getting older, but in reality, they may signal the onset of a deeper, silent condition known as sarcopenia, an age-related decline in muscle mass and function that can strip away up to 15% of leg strength within just 5 years, often without any accompanying pain or outward symptoms until one day assistance is needed for simple, previously effortless movements. Yet despite how widespread and insidious this condition is, the decline it causes is far from inevitable. In fact, groundbreaking research now reveals that the consistent intake of 3 essential vitamins, D3, B12, and B1, thiamine, can dramatically restore leg strength, energy, and balance within days without relying on heavy exercise routines, expensive therapies, or complex medical interventions. As we age, our bodies undergo a cascade of subtle but significant changes. Bone density diminishes, blood circulation slows, and muscle fibers weaken, particularly in the lower body, driven by a combination of nutrient deficiencies, reduced mobility, and impaired neurological function. Among these, vitamin D3 stands out as a master regulator of muscular, skeletal, and neurological health. It facilitates calcium absorption, critical for bone strength, supports muscle contraction and coordination, and enables proper nerve signaling to prevent atrophy and falls. Yet the body's ability to produce D3 declines significantly with age due to reduced sun exposure, thinner skin, and weakened liver and kidney function, often resulting in symptoms like leg cramps, chronic fatigue, and balance difficulties that are commonly and mistakenly accepted as natural signs of aging. Clinical studies back D3's powerful impact. Research from the University of Birmingham found that just 800 IU of D3 daily over 5 days increased leg strength by 19%, while a Harvard study linked D3 deficiency to a staggering 40% higher risk of falls among older adults. For optimal benefit, D3 should be taken in doses ranging from 800 to 2,000 IU each morning alongside a fat-rich meal, such as eggs, avocado, or yogurt, for best absorption, though higher doses above 4,000 IU should be avoided without medical supervision to prevent risks like kidney stones or nausea. Meanwhile, vitamin B12 plays a critical role in maintaining nerve health and ensuring that signals between the brain and muscles remain sharp, synchronized, and responsive, a function that directly impacts balance, gait, and reaction times. Unfortunately, as people age, the body's ability to absorb B12 from food diminishes due to lower stomach acid levels, especially in individuals using antacids, metformin, or following vegetarian or low-meat diets. Deficiency symptoms often mimic aging issues: tingling in the feet, numbness, unexplained leg weakness, and difficulty with coordination. Oxford University found that seniors with low B12 levels walked slower and had twice the fall risk, while a trial published in the Journal of Gerontology showed that supplementing 500 to 1,000 micrograms of methylcobalamin daily improved mobility, nerve sensitivity, and muscle reaction times within 8 weeks. The best way to take B12 is as a sublingual under-the-tongue tablet around midday, ideally with or after lunch, to prevent any potential sleep disruption and to maximize absorption, particularly in those with compromised digestive function. B12 is water-soluble and generally safe even in higher amounts, as the excess is naturally excreted by the body. Then there's vitamin B1, or thiamine, an essential nutrient for converting carbohydrates into ATP, the primary energy source that powers every movement, from rising out of bed to climbing stairs. Thiamine supports not just energy production, but also nerve conduction, muscle responsiveness, and endurance, making it a foundational component of muscular vitality. However, B1 levels can plummet with age due to multiple factors, including the use of diuretics or antibiotics, alcohol consumption, and diets lacking whole grains or legumes. When thiamine levels dip, seniors often feel a dragging sensation in the legs, unexplained fatigue, or even pain and cramping after short bouts of activity. A 2021 study from Tokyo University found that nearly one-third of seniors had clinically low B1 levels, directly linked to decreased leg strength and slower walking speed. While research published in the Neurological Sciences journal demonstrated that supplementing 100 milligrams of thiamine daily significantly boosted energy, endurance, and movement in 82% of older participants in just 1 week. For maximum benefit, B1 should be taken with breakfast, ideally alongside a protein-rich or complex carbohydrate meal, like eggs with whole grain toast or a legume-based dish, to enhance uptake and support muscle repair and energy replenishment. While all three of these vitamins individually support different facets of leg strength and mobility, their real power emerges when taken together strategically, creating a synergy that restores energy, enhances coordination, and rebuilds muscle resilience. To implement this approach, take 800 to 2,000 IU of vitamin D3 in the morning with a healthy fat-based breakfast. Follow with 50 to 100 milligrams of vitamin B1 during the same meal to kickstart energy metabolism, and then take 500 to 1,000 micrograms of B12 at lunch for optimal nerve support and reflex sharpening. Multivitamins, while helpful for general coverage, often contain inadequate doses of these specific nutrients for therapeutic results. So reading labels is essential, and individualized supplementation is often more effective. Equally important is consulting a healthcare provider before beginning any high-dose regimen, particularly for individuals on chronic medications or those with kidney or liver conditions, as D3 can influence calcium levels, and prolonged high doses of certain B-complex vitamins, like B6, may pose risks such as nerve irritation. Routine blood work every 6 to 12 months is a prudent measure to monitor levels, adjust dosages, and prevent potential side effects such as headaches, constipation, or nausea that can occur from oversupplementation. The outcomes, however, are often life-changing. Older adults who once struggled to walk to the mailbox report feeling steadier and more confident within days of starting this vitamin protocol. Those previously plagued by tingling legs or balance issues say their symptoms fade noticeably, replaced by a sense of strength and vitality they thought they'd lost for good. D3 begins to restore power to weakened muscles, B12 reestablishes clarity and coordination in movement, and B1 injects new energy into every step, allowing even previously inactive seniors to regain independence, participate in social life, and enjoy movement without fear of falling. For seniors dealing with limited mobility, medication side effects, or dietary restrictions, especially those avoiding meat or struggling with digestion, these three vitamins offer a non-invasive, affordable, and scientifically validated way to reclaim what age has quietly taken. What's essential, however, is to act, not later, but now, because the longer sarcopenia and nerve degradation are left unchecked, the harder they become to reverse. Armed with the right information, medical guidance, and daily discipline, individuals over 60 can rise above the myths of aging and restore strength, purpose, and freedom to their lives, one confident, pain-free step at a time.